We have just seen 3 cases in a row of kidney cancers. They were all the classical garden variety clear cell hypernephroma. There's because the pelvis of the kidney, in other words, the minor and major calyces and the pelvis is lined by transitional epithelium. Some of the kidney cancers are transitional cell carcinomas, the same types that you might see in the ureter or bladder because it is the same type of mucosa. Here, you could see a normal, smooth, transitional type mucosa. Perhaps it's leading into a major calyx here. Perhaps this is the pelvis. But you could see now, apparently growing from this is an irregular mass extending out into fat and does not have a smooth appearance. This is exactly what the papillary transitional cell carcinomas of the renal pelvis or minor calyx or major calyx look like. Here is a microscopic view. In this microscopic view, we could see a central core of pink uniform tissue. I suspect it's mostly fibrous tissue because it is. And all of these blue areas are transitional cells. Because some of them grow in a papillary fashion, you can call this what most of the transitional cells are, papillary transitional cell carcinomas. This is all carcinoma. These are all papillae, and all these little whitish or pink, more pink areas is the core of the papilla. Notice that it is infiltrating. Notice it is pushing here into the fibrous tissue as well. And notice once again that if really it has so much a resemblance to so-called normal transitional epithelium, except that it's a little bit thicker and it's not as organized. This is a moderately well differentiated papillary transitional cell because the transitional cells in most areas do not look horribly different from what normal transitional mucosa should look like. Nevertheless, it is infiltrating here into the underlying connective tissue. And transitional cell carcinomas occur wherever there is transitional mucosa. So it's not just the bladder, it's not just the ureter, it's also the renal pelvis. It also could be a major calyx, it also could be a minor calyx. It would not be likely for a transitional cell carcinoma to grow way out in the cortex like a clear cell carcinoma might be, because there is no transitional epithelium out at the periphery of the kidney. It remains concentrated in the renal pelvis area. And thank you very much.